Hello, myself Dr. Mahinder Singh, working as senior resident in Department of Psychiatry at Medical College Hamirpur. Today I want to make you aware about depression and anxiety, and but your family members and your friends, they can help a patient with depression or anxiety if someone in your family or someone of your friend is suffering from mixed anxiety and depression. Firstly, family member or a friend, they should know what depression is, how a depression presents, what are the symptoms in a patient of depression. That patient can be your friend, that patient can be your family member. So, firstly, if you are aware about the signs and symptoms of depression, then you can think about or you can advise your family member or your friend how to deal with him. Firstly, a family member or a friend should know how a patient with depression, who, whether he or she is his family member or his or her friend, like you are staying in a hostel and you have a roommate. He was brilliant in study initially, but gradually over a period of 6 months to 1 year, there is academic declines in your patient. That patient is your roommate. So if there is academic decline, there can be some reason. How can you make about that academic decline that is your friend is facing? That is due to depression. Along with that academic decline, he is losing interest in daily routine activities like he was initially shaving regularly once or twice a week. He was cutting hairs once a month. He was taking walks regularly. But now all his routines are impaired. Like he is not taking baths on daily basis. That was initial. Or he is not grooming himself well. That was initial. And during talking, he is not sharing anything with you. He was sharing initially. Then you can imagine or think that there is something wrong with that person. So now you know that patient has lost interest in his study. He is not interested to groom himself, take baths. You know? He has lost taking part in sports or any extracurricular activities, or to an extent that he is not talking to you even. So that patient, he can be suffering from depression. So now you should talk to that person that what are the consequences or what are the reasons behind your this change in behavior. So you should try to know from that person, but that particular person is not sharing his views about changing his behavior. So for that patient, what is the role of you as a friend, because he is your roommate in hostel. So now you know that patient has some symptoms of depression, and these are impairing in his day-to-day activities or routine activities. Now you should try to make that patient out of that depressive symptoms or depressive behavior. In that, what can you do? In that, you can do that. Firstly, you know that a patient is having a major mental disorder, which is depression. So you should talk with that patient. First thing is that you should talk with that your roommate. That what are the problems? Why are you so upset? What are the reasons behind? Is there any problem in your family, like not going good with father or mother or any sister or any relationship issue, or you are not enjoying this academic profession for which you got admission. So you should talk about that purpose. Now you should talk about that person that is there any relationship issue you are facing with your fiance or your partner. Basically, these patients do not disclose their secrets with you know, but you should try to make them out of their this behavior. So first thing, you should talk. You should make a rapport with him. Try to take him out to a movie or kind of sports he was taking part initially. Like he was playing cricket and now he has stopped playing cricket. He was initially playing some mobile games, but he has quit playing mobile games. So, but what is your responsibility? Your responsibility is to try to play with him. Like he was initially playing cricket, so try to play cricket with him. He was playing video games, so try to play video games with him. Or he was a champion of chess. Now he has stopped playing chess. So your responsibility is to play chess with him so that he start sharing his view with you. So a patient of depression, you can identify and you can act to make him out of his change in behavior. So as a friend, because he is not letting others know about his behavior, but by signs and symptoms, I made you aware about sometime before. By these symptoms, you can even try to talk with him and take part in routine activities and get him involved in those activities he has put in which he was champion. Like there is a person who got admission in medical college, but he was interested to become singer. Due to pressure of family member, he took admission in medical college, and he is your roommate. So, what will be your responsibility for your roommate because you are his friend? You should firstly uh, made rapport with him and identify the causes why he is so upset. So if you are able to make the causes are which he is upset, you can work accordingly. If you are not able to made out that he has depression, you can take help of other colleagues like another roommate who is your neighbor or his or her friend for which he is talking on phone, yeah, some of your teachers, you can take help. They will guide. But in this, first thing is that you should be aware that your roommate or particular person that is facing some issues by changing his behavior. So these are some of the symptoms of depression. You can see that patient will not say that he is suffering from depression. He has a loss of interest in everything. You have to make out that patient is having some issues in day-to-day activities. So as a friend or as a colleague or as a family member, you can make out that patient has some problems with his psyche, and you can help him or her to make out of change in behavior. For that, you should be aware of depression. Other things I want to talk about is anxiety. Symptoms of anxiety are that there are so many somatic complaints like I have pain in head, I have headache, I have throat ache, I have pain in my legs, or I have sweating, palpitation, I feel restless, I have palpitations, and I am apprehensive that everything will be bad. Like I have pain in chest, I think that I will be die of heart attack. I have pain in throat, and my parents died of lung cancer. I may have lung cancer. These are some of the symptoms of anxiety. And this anxiety and depression they occur almost together in most of the persons. So symptoms of depression and anxiety they are present mostly, and a family member or a friend or a roommate that can identify and um, take that persons to any professional. Like firstly, you have made that your roommate has depression or anxiety, so you should initially try yourself to get him out. And if you are not able to get him out of his anxiety and depression, you should take him to psychiatrist. Just like I have given example of a hosteler, similar is the thing. Like you are a parents and you have two children. One of them he is studying in plus two. He was topper in 10th. He was topper in plus two, but now in after plus two there is academic decline, and he has lost interest in studies. He has lost interest in roaming himself, roaming around, staying inside a room, so much depressed. He is not initiating eye to eye contact. He is not giving reply to your questions. So these are some of the symptoms which guides parents that his or her children, he or she has signs of depression and anxiety, and you can involve him how to get out of these symptoms. That you have to make your child your friend, best friend. How can you be his or her best friend? You can be his or her best friend by communicating with him. He is interested initially, playing with him in the games he was initially interested, going for a trip outside, and you can help him how that how he can come out of his this depressive feeling, his anxiety, because he will be involved in other day-to-day activities with you when you are on a trip. By even a trip of 2 to 3 days, it can be wonderful to make him out of depression. And if you are not able to make him out of depression even after a trip he was initially, then better that you should take him to a psychiatrist or a counselor, or a health counselor, child counselor, adolescent counselor, which are available in the nearby medical college. So as a friend, as a family member, you can help a patient with depression and anxiety. So this was all I want to make you aware about some symptoms of anxiety depression and how you can made out that he or she has anxiety and depression, and how to move out your friend out of depression, and which are the people's nearby available professionals which can help you to help your family member on it. So this was all about. Thank you for giving me opportunity to talk about depression and anxiety and how you can help your friend or a family member. Thank you.